Hi, my name's Maddie. I'm going to be your nurse today. Can you tell me your name and your date of birth?
Glenn, October 1960.
Okay, awesome. So I'm going to be doing a full head to toe assessment today. Is that okay with you?
Yes.
Okay, great. I'm going to need you to do a couple different, like lay down and be in a couple different positions. Are you comfortable with that?
Yes.
Okay, great. I'm going to wash my hands and provide privacy for you. So the first thing I'm going to do is come in and inspect and see that your skin color is appropriate, your posture is good, your speech is fine, your mood affect is appropriate, and your hearing seems to be intact. Do you have any hearing issues or anything like that?
No.
Okay. And you have no physical deformities?
Correct.
Upon inspection. Okay, great. So the first thing I'm going to do is inspect your hair and your scalp. I'm just going to check for any patterns of baldness, make sure that your hair is evenly distributed. Do you have any problems with dandruff or anything like that?
No.
Okay, great. I'm going to move on to palpating your scalp. Let me know if you have any tenderness.
No.
Any tenderness there?
No.
Okay, great. And there's no lumps or bumps or anything like that. Can I have you do some facial expressions for me? Can you smile? Great. Can you frown? Awesome. So those are symmetrical, no differences from the left to the right side of the face. So now I'm going to palpate your TMJ. Can you open your jaw for me and close? Great. No popping or anything like that. Was that uncomfortable in any?
No.
Okay, awesome. Can I have you clench your teeth down for me? Great. So then I'm going to take my pen and I'm going to touch you with the soft side of the pen and a pointy side. Can you close your eyes and tell me which side you think you're feeling? Side 1.
Pointy.
Side 2.
Soft.
Okay, great. That was cranial nerve 5 that was just tested. Now I'm going to test your cervical strength. So can you push on my hand? Okay, great. And how about the other side? Awesome. Even and appropriate. So then I'm going to check your eyes. So I'm going to use my flashlight. Can you take off your glasses for me, please? Thank you. If you could look straight ahead, I'm just going to shine my light into your eyes. Okay. So pupils are even, reactive, round to light. I'm going to check your conjunctiva here. Great. And the other side. Awesome. So your conjunctiva is moist, sclera is white and pink. So you're okay there. So then I'm going to test your eye movement. So if you can just, without moving your head, follow my fingers. Okay. So that was cranial nerve 3, 4, and 6 that was just tested. Now I'm going to have you cover one eye and look at that Snellen chart that is 20 feet away from you and read the smallest line that you can.
BFDSC.
Okay, and how about the other eye?
TRXYT.
Okay, so vision is good, 20/20 vision in both eyes with the glasses on. Then I'm going to check your ears. So your ears look even from here. Do you have any hearing issues? Are you hard of hearing or anything like that?
No.
Okay. Have you had any other issues with your ears? Drainage, any lesions, itching, redness?
No.
Okay. I don't see any redness on your ears and I don't see any lesions either. So I'm going to take my light here and check the inside of your ears. Okay. I'm going to check the other side. Great. No redness, swelling, no lesions. And your eardrum was pearly and gray, so that's good. That's a normal test. So then I'm going to test your hearing with a whispered voice. So can you repeat back to me what I whisper in each one of your ears?
7. 9.
Okay, good. That's the other ear.
8. 2.
Awesome. So that was a normal test. Now I'm going to use my tuning fork, and I'm going to hold my fork, after it vibrates, I'm going to hold it in the front of your ear and then in the back. And can you tell me which one sounds better?
Mm-hmm.
Okay. In the front.
The front.
Okay. Front.
front.
Okay, great. And that's a normal finding. Air conduction is better than bone conduction. So then I'm going to do my tuning fork one more time and put it on top of your head, and you tell me if you hear it better in one ear versus the other, or if it's equal bilaterally. Okay?
Equal.
Great. So normal findings for the ear exam. So now I'm going to move on to your nose and sinuses. And from inspection from the front, it looks like you're not asymmetric in your nose, no lesions, anything like that. Have you had any trouble with allergies or anything lately?
No.
Okay, great. Can you hold one nostril and blow in and out for me? Great. And how about the other side? Awesome. And since I know that your nostrils are patent, if in order to test for cranial nerve 1, I would have you smell a sweet something and a bitter smell, and then see if you could tell me the difference with your eyes closed. Now moving on, I'm going to palpate for tenderness in your sinuses. Could you remove your glasses for me? Great. Just tell me if you feel any tenderness in here.
No.
Okay, great. So now I'm going to inspect the inside of your nose for any lesions or symmetry. Can you tilt your head back for me? Okay. Great. No blockage of the nasal passages. Mucosa is moist and pink, so that's normal. So I'm going to move on to your mouth and your throat. Have you been having any trouble with hoarseness or anything like that in your throat?
No.
Okay, great. So I'm gonna, if you could open up for me. Great. Do you wear dentures or anything like that? Mm-hmm. Okay, awesome. Then can you say Okay, so your uvula is in the middle of your throat, and it just went up with, while you said your mucosa is pink and moist, no deviation of your tongue, so that's good. Now, in order to check for cranial nerve 9 and 10, I would assess your gag reflex and also test the sensation in your palates in your mouth. Okay. So then I'm going to inspect your neck for your range of motion. Can you move your neck or your head from shoulder to shoulder? Okay. Any stiffness there?
A little bit.
Okay. How about from your chin back? Okay, that's great. So a little bit of restricted movement from side to side, from shoulder to shoulder, but other than that, you seem okay. Mm-hmm. All right. So now I'm going to palpate your trachea and then your thyroid. And once I instruct you, can you swallow for me too? No deviation in the trachea. Now, can you swallow? Great. So your thyroid went up and down when you swallowed, so that's a normal finding. Now I'm going to palpate your carotid arteries, okay? Good. Great. And then I'm going to auscultate your carotids. Okay. Okay, no bruit was detected in the carotid arteries upon auscultation, so that's good. Now I am going to look at your back. Have you been having any lung problems? Okay, great. So I'm going to check your back and make sure that there's no lesions or anything like that on your skin, and that looks okay to me. And now I'm going to check for expansion in the back. So if you could kind of turn to your side for me. Thank you. And can you breathe in and out? Good? Okay, awesome. So good expansion even on both sides. Now I'm gonna kind of push around and you tell me if you have any tenderness, okay? Any tenderness?
No.
Okay. I'm gonna test for firmitis, so if you can say 99 for me.
99.
Okay, and again.
99.
Good.
99.
Okay.
99.
Okay. So no firmitis there, normal findings, and then I'm just going to take a listen to your lungs as well. Take a few deep breaths for me, in and out. clear lung fields. I don't hear any crackling, any rhonchi, anything like that. So, or any wheezing. So then I'm going to test for CVA tenderness. So I'm gonna pound on your back and you tell me if it's tender, okay?
Mm-hmm.
Any tenderness there?
No.
How about there?
No.
Okay, great. I'm gonna percuss. Okay. Resonance heard in all lung fields, no dullness detected. So then I'm going to, respirations are 18. You don't have any shortness of breath or anything like that?
No.
Okay, great. Now I'm gonna listen to your heart. So if you could lean forward for me a little bit. Gonna listen for a murmur. Okay, that seems to be normal. S1 and S2 noted, no heart murmurs or anything like that. So I'm gonna, if you could lay down for me.
This is the best part.
Hey, I'm gonna listen to your heart in 5 different places, okay?
Mm-hmm.
Okay. So first I'm gonna listen in the aortic, pulmonic, Erb's point, and mitral. Okay, great. All normal. S1 and S2 noted in all areas. In the aortic, pulmonic, tricuspid, and the mitral area. So then I'm going to inspect and auscultate the 4 quadrants of your belly. Is that okay? Have you been having any tenderness?
No.
Okay, great. Doesn't look like there's any bloating or bruising or swelling, anything like that. So I'm going to take a listen. You can breathe normally for this part. Okay. Good bowel sounds noted in all 4 quadrants. And I'm going to palpate. Tell me if you have any tenderness. Any tenderness anywhere?
No.
Okay, great. Now I'm going to percuss for your liver and your spleen. Okay. Dullness noted where the liver was and the spleen. No tenderness or anything like that. Normal abdominal findings. So then I'm going to take a look at your lower extremities and I'm going to check some of your pulses. So I palpated your inguinal nodes and there was no masses or tenderness there. And your femoral pulse was normal upon palpation. So I'm going to move down to your tibial pulse. Okay, that's normal. Good pulses in both of your ankles there. And I'm going to take off your slippers. Is that okay?
Sure.
Okay. I'm going to feel for your pedal pulses. Good. And then I'm going to take my pen and I'm going to test for your Babinski reflex. So I'm going to swipe my pen on the bottom of your foot, okay?
Mm-hmm.
Normal Babinski reflex. And then I'm going to check for hair distribution, no swelling, no edema noted, no redness. Do you have varicose veins when you stand up?
No.
Okay. So then I'm going to test the strength of your upper and lower extremities. So if you could push against my hands with your feet. Okay, good. And how about pulling back? Awesome. Can you sit up for me so I can test your leg strength? This will be the last part of the exam. Can you push on my hands? Great. And how about pull? Awesome. Now I can see that your skin is appropriate. You don't feel any warmer than you should be. No swelling or edema noted. So can you squeeze my fingers? Great. Even there. And can you push on my hands? Good strength there. And can you pull on my hands? Awesome. Great. And then I'm just going to test one more reflex for you. I'm going to take my reflex hammer and I'm going to hit your knee on each side. Good. Okay. And then one more on your arm. So if you can hold out your wrist for me. Okay. Good. Anything you're concerned about? Any concerns I can address for you?
Nope.
Okay, great. So your exam was all normal. You checked out good. So thank you for being my patient. And have a great rest of your day.
Thanks.